Hi, Maddie.
Hey, how are you?
I'm fine. You finally agreed to treat my tennis
Yes.
elbow,
Yes, I
or
finally have time.
as we call it, lateral epicondylitis.
Mm-hmm.
All right, little quiz.
Mm-hmm.
What are the components of the muscles going to the lateral epicondyle?
You have the ECRV, the EDC, the EDM, and the ECU.
How do we know which of those muscles or tendons are giving me the problem? Like, what types of tests would we get?
So usually you can do a history exam or a physical exam. Sometimes you need an MRI, maybe an ultrasound, but sometimes those tests aren't even needed.
Because you can just go on history and kind of
Right.
like, where does it hurt?
Right.
Well, it hurts right where most people have tennis
Right.
tennis elbow. Good. All right. So with all those muscles, how do we pick which one to treat? Which one should we treat?
We're going to treat all of them. Mm-hmm.
Great.
Yeah.
Oh, okay. Perfect. All right. So you're going to start with the focus shockwave, and you got the gel on there. What numbers do we usually try to get to in order to get good amount of healing?
You like to be at 20
Okay.
millijoules per millimeter squared.
Millijoules per millimeter squared. Right. Ah, what are you doing?
I'm fixing you.
Oh, okay. Am I one of the toughest patients you've ever dealt with?
Definitely not.
Oh,
Definitely not.
okay.
Nope.
What number are we at right now? You said we got to get to 20. What are we at now?
You're at 2.
Oh, okay. You can probably turn it up. It doesn't really hurt that much. Okay, so yeah, you can turn it up. Maybe see how we're feeling. Maybe try it at 3. Keep going. 5, 7. Okay, great. Keep going a little bit further. It doesn't hurt at all. I can feel little twinges every once in a while where you get to the place where it typically hurts me.
Okay.
And I usually hurt right up next to that bone up in there.
Okay.
And you can always, that's a nice thing about having this along with your fingers, you can kind of feel where the pain is, and then we can kind of get down and focus on that area with this shockwave. All right, so this is focus shockwave, and we've got another shockwave. What's that one called?
It's radial. So it's just treating larger areas and more superficial things like muscles and tendons.
Okay. All right, so we're using focused on this, and we can also use radial on this. Which one's better?
They're both good because they complement one another. So we use them together.
Okay. And so we've done 300 shocks. Typically, we're going to get up to 1,000 or 2,000 shocks per treatment session with the focus.
Correct.
So why might it be a good idea, in some cases, to let the patient hold the handpiece?
Well, I can't feel the patient's pain. So if I hand it off to them, they can find the pain and pinpoint it a lot easier.
Oh, can I hold it?
No.
Oh. Okay. All
Hold
right.
this real quick though, because I'm gonna grab something.
Okay.
No, I'm just kidding.
Oh. All right. All right. We have finished with focus shockwave for my tennis elbow. And we're going to move on to radial shockwave.
Correct.
Great. And so radial shockwave is a little bit more for using on bigger areas. And I kind of tell patients it's kind of like miniature jackhammer.
Yes.
Right? And we can adjust it. So it can either be really strong or really light based upon what the patient can tolerate. Okay, great. Let's give that a try. So this one makes a little bit more noise than the other one, right?
Right. It's a little louder.
Great. And then more shocks are given with this. It's kind of really fast.
Correct.
So the other one's only going at four pulses a second. This one we got up at maybe 12 or 13. Okay, great.
Right.
All right, cool. And it's also adjustable, right? So this
Correct.
is right now at 1.3.
Yeah.
What's like a normal range that you get to?
Usually 1.3 to 2.5.
So you're telling me again I'm on the low end.
Exactly.
Okay.
Exactly.
All right. Great. So as we're wrapping it up with the shockwave, the radial shockwave, favorite condition to treat with shockwave and why?
Plantar fasciitis.
Okay, so that's pain at the bottom of the heel. Really painful.
Correct.
I've had it.
Yeah.
I hope you never have it. So why do you like treating it?
Because it's something that's painful to people and they tend to just live with it.
Right.
And it can be treated in 2 to 3 treatments.
Very cool. And have you ever had a patient come in to get shockwave? They've been suffering with this plantar fasciitis for months or maybe even years, and you see them walking out better after the first treatment?
Yep.
Feels good, right?
Relief.
Yeah.
Yep.
Instant relief. And it's not usually you need to get a couple more, but it is fun to see people walking out feeling a lot better.
Yeah.
Cool. So excellent. Any final thoughts for our audience today?
Yeah, your daughter is a lot better at receiving treatment. She's a lot tougher than you are.
Thanks for nothing, Maddie. Really appreciate that. Have a good day. So thank you for treating my elbow.
You're welcome. Do you feel better?
I do. Thank
Good.
you, Maddie.
Good.